Hello, my name is Lee Presser. This is my show. I speak frequently to very interesting people. Some of these conversations are so exciting, so intellectually stimulating, I thought others might like to listen in. This is the reason we started recording Conversation with Lee Presser.
Welcome to Conversation with Lee Presser. Medicare is a national social insurance program administered by the U.S. federal government. In July 1965, Congress created Medicare under Title XVIII of the Social Security Act to provide health insurance to people age 65 and older, regardless of income or medical history. Medicare provides health insurance for Americans who have worked and paid into the system. It also provides health insurance to younger people with disabilities. Our guest today is Ken Schmidt, an insurance professional who specializes in Medicare coverage. Today we will discuss how to sign up, the various options to be considered, and some of the pitfalls to be avoided. Ken Schmidt, welcome to Conversation.
Thank you.
So, we had a conversation preview to this, so I learned a lot about this from you, so it'll make it a little bit easier. You told me, let's just start from the very beginning. You get 3 months out from your 65th birthday.
Right.
You're going to get almost a happy birthday note from the government or Social Security. Well, let's talk about that.
It's not too much of a happy birthday because I think a lot of people think it's junk mail and they throw it away. The government says, though, that 3 months prior to you turning 65, they send out actually your Medicare card with A and B on it. Okay, A, hospital, and B, medical, which we're going to talk about.
This is the real card.
This is the real card. It's a red, white, and blue card. They say they send it out 3 months in advance, and that gives you the opportunity then to do something by the time you turn 65.
But it's not effective. The card is not effective
right.
until the birthday month.
Actually, it's effective on the dates that it says.
Okay,
so the dates are on there, but typically it'll be the first of the month when you turn 65. The card is red, white, and blue. The little package that it comes with gives you an opportunity if you decline Part A and or Part B, or want to decline Part B, because some people do if they're still working. Okay, it gives you the opportunity to do that. It does tell you that the premium for Part B is in Bravo, which we'll talk about. It will be deducted from Social Security unless you're not on Social Security. So there's some things that are in that packet. But I will tell you that it's not necessarily a perfect system. Or maybe it is a perfect system and people are just throwing it away. But I run across people regularly who have said, I never got the card. Just got one yesterday where somebody said, I never received a card from Medicare. So Medicare says we send them out to everybody. So I typically tell people that you have to think about Medicare prior to turning 65, not actually on the day that you turn 65, okay? The people that are eligible, you mentioned it a little bit, it's a little bit more involved in that, but basically, traditionally it was people, and that's the way it was set up, for people that were over 65. Okay, so those people, when they're turning 65, and it takes effect on the first of the month when you turn 65. It's not, if your birthday is on the 29th, it doesn't take effect on the 29th. It takes effect on the first of the month that you turn 65. But if you've been on Social Security Disability, SSDI, for 24 months, then you also qualify for Medicare. So a lot of the rise in a lot of people qualifying for disability means that after they've been on disability for 24 months, they will also qualify for Medicare. If you have end-stage renal disease and are on dialysis, you qualify for Medicare. So those are at least some of the ways, no matter what age. So you could be 35 years old, and if you have end-stage renal disease and are on dialysis, you would qualify for Medicare. So you know, that's the situation with regards to it. But again, it's not an exact science. The cards are supposed to be coming out, but the people say sometimes that they don't. The things that you have to think about when you're starting to enroll or thinking about enrolling is what's called enrollment or election periods. And the enrollment periods, initially, it's called the initial enrollment or initial election period. And that's 3 months before you turn 65, the month you turn 65, and then 3 months after. So you've got a 7-month window, and that is the best time for someone turning 65 without any other options with regards to insurance to get into a Medicare program. Okay?
Are you talking about what people traditionally call the supplement?
No.
Or are you talking about we need to I think first, before we go any further, is let's talk about these parts. You mentioned A and B.
Okay.
Let's just talk, what is A, what's B, C, D?
Okay. Part A is hospital, and it includes skilled nursing, it includes hospice care, it includes home health care. That's Part A. Now, as far as paying for Part A, people say, well, it's free. Well, it's not really free. You've paid for it your working life. So in this country, if you've worked 10 years in the United States, okay, or 40 quarters, the IRS calls it, okay, then you qualify for Part A as an alpha. So you're not paying a premium for Part A when you enroll in it now. And almost everybody enrolls in Part A when they become age 65.
So this is the FICA tax, which has now been renamed payroll taxes.
That's correct. Right. And that's what FICA has paid for, your working life. Now, Part B is in Bravo. That's the medical portion. That includes things like doctor's visits. It includes includes surgery, in and out. It includes in and out of the hospital. It includes lab services, mental health, lots of things that are covered under Part B is in Bravo. Part B has a cost, though, okay? And the cost for 2015, the basic cost, I guess I should say, is $104.90. So $104.90 per month. And for most people, if you're on Social Security, that will be deducted directly from your Social Security check because everybody does it that way. It's easier for them. But if you're not on Social Security yet, okay, but you're still 65 and taking something with Medicare, then you're going to pay that premium quarterly. Now, I said it was $104.90, and for most people it is, but for some people it isn't. If you make more money, you may pay more for Medicare Part B as in Bravo, and also Medicare Part D, which we're going to talk about in a second, which is the drug card. The premium is called, or the penalty or the fee or whatever you want to call it, is called IRMA, Income Related Monthly Adjustment Amount. And that's an amount tacked onto an individual's Part B and Part D cost if they are an individual that exceeds $185,000 in income.
$185,000?
I'm sorry. My fault, 85,000. Correct,
right.
85,000. Or if they're a couple, 170,000. And if someone says, well, you know, what do they include in that? Because that comes up all the time. I tell them to Google MAGI, M-A-G-I. It's Modified Adjusted Gross Income, and it'll tell you exactly what the government takes into consideration with regards to that $85,000 for an individual or $170,000 for a couple.
So if somebody is making like $90,000 a year, okay,
and an individual,
instead of $104.90, what could it go to?
Well, there's a table that steps it up, but depending on what's someone's income, it could be several $100s in additional amounts that they would pay for Part B and Part D.
So it can be steep.
So, right, correct. Yeah, so it can be steep. You know, I mean, I guess the theory there is that the people that make more money can afford more money. So you know, that's an editorial comment. I know it is. I mean, it's but somebody is, for most people, it is not an issue. Okay, so we talked about Part A and we talked about Part B.
Right.
Two more parts. Part C is in Charlie, and Part D is in Delta. Okay. I'm going to talk about Part D first. Okay. Part D is the drug card.
This is from when George Bush Jr. was president.
That's correct.
That's when
George W. Bush. It started January 1st, 2006. So at that time, well, before that, there wasn't a lot of good coverage for you. Basically paid for your drugs for the most part. Okay, unless you were very low income or whatever. So this started a drug program, okay? Started January of 2006. In fact, it goes so far to say is that whenever you become eligible for Medicare, if you don't participate in a Part D as in Delta drug card, then you will pay a late enrollment penalty.
So they're serious about this.
They're serious about it. The penalty is based on the average, it's 1% of the average cost of all the drug cards across the country. It's roughly, I want to say 32 cents a month, okay? Problem is that it's a penalty that never gets smaller and never goes away. So I had a situation just this last fall where a lady who had been on Medicare since 1996 never set up a drug card but wanted to set up one for 2015. But I had to look back to 2006, 7, 8, 9, 10, 11, 12, 13, 14, 9 years times 12 months, and then multiply it by 32 cents. And that's what her penalty will be every month for the rest of her life, even when she gets a drug card or if she gets a drug card. So it's a penalty that never goes away. So it's something that people want to have a drug card. They can do that either by doing it in a standalone situation, or they can buy it within a package, which brings up the next
Right, we'll
part
get into
benefit,
that.
which is Part C, which is Medicare Part C. And that's Medicare Part C or Medicare Advantage. So there's basically 4 parts to Medicare: A, B, C, and D. Not basically, there are 4 parts, okay? Again,
And this is all under the Social Security Act.
that's correct.
Okay.
That's correct. So there's not, I mean, this is all, government-sponsored programs, basically. So that's generally, now, the initial enrollment period I mentioned, that's when someone's first coming on. But you hear things that are popular, you see it towards the end of the year every year, that there is an annual enrollment period or annual election period. And that is between October 15th and December 7th. So anybody can make a decision or change, generally, at that period of time, and it will take effect the first of the next year.
But the changes is not to the A and B part. The changes are to the
Programs themselves.
Right.
That's correct.
Okay.
And in most programs, if you want something besides Medicare, okay, you have to have Part A and Part B. Okay. Now I will tell you, the last enrollment period I'll talk about, and then I'll talk more about the plans themselves. But the last enrollment period is called a special enrollment period, and the special enrollment period is designed for people that move to Florida. Most of the programs that are outside of this, they're concentrated in a specific area, like St. Louis or something like that, or Maryville or whatever, Illinois. But in that situation, individuals have to.
Well, let me ask you this, while you get back on track. When you have Part B, which you're paying this $104.90 per month, this covers, as I've heard it, only, 80% of these doctor bills you're talking about?
Right.
And that leads you to this,
To do something
to
else.
this other part.
Right.
Unless you just want to pay the 20%, and then you don't have to do anything else, except get the drug card.
Right. Absolutely. So what that means basically, and you see this advertised all the time, if you have Medicare Part A and Part B, you will pay 80%, or Medicare will pay 80%, you will pay 20% of the cost.
Now they're paying on the hospital, that's the A part, that's 100%?
80% average over.
Oh, really?
So there are some deductibles that you pay if you go into the hospital. So you pay a deductible, a Part A deductible. There's a Part B deductible. So there are some co-pays that you pay besides, plus co-insurance. Everybody says it averages out to about 20% is what you pay for the cost. So government's
then you get
paying
this
80%,
other insurance,
you're paying 20%.
which will then cover the part that's not being covered by A and B.
Correct.
Okay, now that's
Okay.
our next stop.
Okay. Our next stop then talks about if you have Medicare but you want to do something else. Again, you have to have Part A and Part B. Okay? And then I'm going to think about flipping of the coin, 2 sides of the coin. Some individuals take a Medicare supplement and buy a drug card, a Part D card. Medicare supplement is an insurance policy. Someone buys it, they pay a premium. It's designed to pay whatever Medicare doesn't pay. Okay? Now, one thing to remember about all Medicare plans, a couple things. Always, Medicare is driving the bus. You may be a passenger, but Medicare is always driving the bus. So you're still playing by Medicare rules, and no matter what you buy or get. Secondly,
In terms of coverages.
in terms of coverages. The other thing is that you have to remember that not only that Medicare is driving the bus, but that it's not designed to cover something that Medicare doesn't cover. So, for instance, acupuncture is not covered by Medicare. So I can buy an outside program, but it's not going to cover acupuncture. Okay? So the 2 sides of the coin, a Medicare supplement and a drug card. You buy a Medicare supplement, you pay a premium. In the state of Missouri, the average premium is about $180 a month. Okay? You buy that. And for the most part,
That's per person?
per
Not
person,
couple?
per month. Okay?
Okay.
And that basically pays whatever Medicare doesn't pay, as long as it's a Medicare covered benefit. Okay, so you go into the hospital, Medicare doesn't pay this much, your Medicare supplement pays that. The Medicare supplement is an insurance product, though. It's not a Medicare product. Okay, and there are different programs. The government sets them up. They go from A as in Alpha through N as in November. Okay, probably the most popular plan is Plan F is in Foxtrot. It's the most comprehensive. That's where most of the people, I think, gravitate to because it's the most comprehensive with regards to benefits. And it's in that $180 range. So people buy that. Okay, again, remember, they had to have Part A and Part B.
Pause for a second. So these programs you're talking about, these are not government programs. These are private insurance programs, but they're government regulated by
That's
Medicare.
Correct. So the government tells you what the plans are, okay, but you buy them from an insurance company, okay, and you pay a premium, and they're designed to supplement Medicare. That takes care of the medical portion. The drug portion is a separate issue. That's the Part D part, and you have to have the Part D drug card, okay. The Part D drug card, premiums can run anywhere from $20 a month up to over $100 a month, depending on the plan and the company that you buy it from. So lots of leeway in between.
And the variation is what, over what drugs are going to be covered in this plan?
The plan itself, the basics of the plan work the same way, okay, which I'll talk about in a second. But the things that can be different in the plans are drug lists, which are called formularies, the co-pays that you pay, the network of pharmacies that you use. Those things can be different, okay? But the structure of the plan itself is different, okay? I mean, it's the same among all plans. But it is different from what we had when we had insurance through our company insurance. You know, if you were still covered by your group insurance, and you had a drug that cost $5, you paid $5 for a 30-day supply, 5 times 12 is $60. That's what you paid for that drug that year. Medicare drug programs, and all of them, again, work the same way. They may or may not have a deductible up front, okay? Some of them have a deductible for some of their different tiers, okay, which we'll talk about in a second, okay? There's the deductible stage, and then there's what's called the initial stage. And the initial stage is what I pay or what an individual pays for the drug and what the drug costs the insurance company also. So, for instance, using that same example of a $5 drug, if I pay $5 for the drug, but the insurance company pays $95 for that drug, that means the drug really cost $100. Well, in the initial coverage phase, $100 goes towards a number that is selected by the government each year. For 2015, it is $2,960. So, if all of my drugs add up to $2,960, then I reach what's called the coverage gap. It's affectionately called the donut hole. And then I start paying a percentage of the drugs. In effect, I really don't have coverage. I'm paying a percentage of the cost of whatever the retail cost or the negotiated rate of the cost is of the drug. I pay 45% for brand name drugs and 65% for generics. So that same $5 drug that I was talking about, if I reach the donut hole and it's a brand name drug, it would cost $45 a month. If it was a generic, it would cost $65 a month. And just to be clear, the differential, people say, well, why is generic 65%? Well, generics are much less expensive. So you're talking about 65% of a much smaller amount, and that's the reason with regards to it. That's the next stage. If someone goes through the donut hole, okay, then they reach what's called catastrophic coverage. And then that means that they've come out of pocket for $4,700 in 2015. And they're not over. Okay, then they pay the greater of 5%, or $2.65 for generics, or $6.60 for brand name drugs. And they pay that until, thankfully, they reach the end of the year. Now, before we scare you, all of your viewers, most people do not reach the donut hole, okay? And the ones that do, most of them reach it in the last quarter of the year. Okay, so they reach that, and then they start paying the higher amount, but thankfully they've reached the end of the year and they start over again. But depending on someone's drug use, not just expensive drugs, but the number of drugs. The most I've ever seen one person have is 16 drugs, okay? But, you know, it's not
so
just...
So that person could easily
reach the donut hole.
They reached halfway through the year.
They reached the donut hole in February, okay?
Really?
So they
very
reached
expensive drugs then.
Well, are lots of drugs, okay? You know, when you have lots of drugs, it doesn't take long to reach that $2,950 with regards to it. But then again, you've reached the catastrophic.
Now is this, when you, does this count, so if you are taking a drug monthly, so every time you renew that prescription, that goes against this number,
That's
right?
correct.
It's not the number of drugs, different drugs, it is the number of times you get a bottle.
That's correct. Again, you've paid $5 for the drug. the drug costs $95, $100 goes towards that $29.60. If you paid $200 for a drug, okay, I mean, all of that would add up, and if it reaches $29.60, remember, it's not just what you pay for the drug. That's what we had when we were insured by group insurance under 65. Now
Under
it's
group.
what you pay and what the insurance company pays.
Under group, there was a lot of 90-day supplies. You would get these 90-day
And you can get 90-day supplies, but that still exists, and there are mail order programs available with most of the plans. It depends a lot on the drug itself. You know, if some drugs you can't get a 90-day supply, or the doctor won't give you a 90-day prescription. But generally, if something's available, you know, in a mail order situation, you can get up to 90 days of a particular drug. And then with some companies, there's a discount if you do that. Okay, so one side of the coin still, that's a Medicare supplement, okay, and that's you buy a drug card. So you're paying premiums on both of those things. Now, I think one of the biggest advantages to a Medicare supplement is that you can use any doctor that accepts Medicare. So you can go anywhere in the United States and use any doctor as long as they accept Medicare patients. So if you wanted to go to, you know, a clinic in Rochester, Minnesota, could you do that? The answer is absolutely, as long as they accept Medicare. Okay, there's no restrictions on that, so there's not what we call, there's no networks with regards to it. But that's one of the biggest advantages. Now, that being said, you pay a premium, and premiums are just like you pay car premiums and you pay insurance, you know, you pay homeowners insurance and whatever. The premiums you pay whether you use the insurance or not. So some people say, you know what, I'm going to choose the other side of the coin, and the other side of the coin is a Medicare Advantage program. And a Medicare Advantage program, well, the advantage basically is it's going to cover the Part A and Part B benefits, okay, because that's the agreement they have with the government, and it's going to throw in extra things. It's going to throw in a prescription drug card. It's going to throw
That's included.
That's included in a Part
C.
So
you don't have to get that
yes,
separately.
That's correct. It's included in there. It's going to throw in a minimum hearing benefit. It's going to throw in a minimum vision benefit. It's going to throw in preventative dentistry. And it's also going to throw in a very popular program that seniors like called Silver Sneakers, which allows them to access fitness facilities like the YMCA in the area and other, you know, Gold's Gyms and places like that. It allows them to use them. Instead of being a member, you can just use your Silver Sneakers card to get into there. So
okay, now pause it just a second. Here in the last, we got about 7 minutes here.
Okay.
I want to make sure we cover this advantage pretty thoroughly.
Okay.
You said that you're having minimal eye, minimal hearing,
vision, hearing, and preventative dentistry.
Okay. When you say minimal, what are we referring to?
Well, there's a small.
Is there a dollar amount,
yeah.
or is this a percentage amount, or
a
what?
Medicare Advantage, and the one thing different is remember we talked about the supplement and the drug card having premiums. Most of the Medicare Advantage plans have little or no premium. And the reason is because you're paying that $104.90, but also the government is paying a portion of that premium for you, since this is done directly through the insurance company, so the claims aren't sent to the government. So that premium is being paid, but it's being paid by the government. So the minimal, like on vision for some of the programs, you would get like $100 every 2 years with regards to glasses. You
said $100 every 2
years towards with glasses. Vision, you get maybe 1 or 2 exams a year. Okay, at a copay. Because with a Medicare Advantage plan, you pay a copay. Okay, you haven't paid a premium, but you pay. So if you see a doctor, you may pay a $10 copay or a $15 copay. If you see a specialist, you pay a $40 copay. But a Medicare Advantage plan has an out-of-pocket maximum, not a deductible, an out-of-pocket maximum, and everything medical goes towards that. So if you see a doctor and it's $10, $10 goes towards that out-of-pocket maximum. For instance, $2,300, okay? It goes towards that. Or you go see a specialist, it's $35, that goes towards that. Okay, if you come out of pocket for whatever the out-of-pocket is for that year, then the insurance company takes over for the remainder of the year.
And how much is this total out of pocket?
Depends on the company. You know, they range, but you know, some of them, you know, could be I mean, they're all over the place. 2,300, you know, 2,900, 3,000, 50. It just depends on the particular thing.
So it's not like a huge. It's not like these today where you get $6,000 deductibles, $10,000.
It's not like the Affordable Care Act with those higher things.
Right.
But there is an out of pocket, and I will tell you, in this area, less than 5% of the people probably reach that out of pocket maximum. So the opportunity to save something exists, okay, with a Medicare Advantage plan. It does not exist with a Medicare supplement. So the last thing you asked me was with regards to dental. And the dental benefit, if you use their dentist, is a pretty good benefit. You get, it's only preventative, but you get 2 cleanings a year, 2 exams, and 1 x-ray a year. So that's included. And for my dentist, that's about $400 or $500 a year that you would save. Now, I talked
that's about
about
as much as you need unless all of a sudden you're having
correct.
dental decay.
Remember, on the one side of the coin, it said you had to pay premiums, and you can use any doctor you want. On the other side of the premium, okay, or the other side of the coin, you pay little or no premium, okay, and you've got an out-of-pocket maximum, so you're protected there. Okay, it's not. So if you had a $500,000 bill, the most that you could come out of pocket would be that out-of-pocket maximum. But the thing about the other side of the coin is you have to use their doctors typically, their hospitals, and their pharmacies. And generally speaking, for most people, that is not an issue. The networks are pretty expansive. Some are less. Some don't cover all the hospitals. Some do. It just depends. That's why, frankly, it's my job to sit down with someone and find out what works best for them.
People, so you would be able to tell, like, if I had a particular dentist, we'd be able to look at all your programs and say, oh yeah, your dentist is in this program.
Right.
If you wanted to keep that dentist, or your doctor is in this particular group, and so you've got to go, if you want to keep that doctor under the Advantage plans, then you would have to go with that particular program.
That's correct. And frankly, I spend anywhere between an hour to 2 hours with an individual because we're required to look up their doctors, look up their dentists, look up their drugs to make sure that they're covered in a particular program that they enroll in. So, that's part of the requirements that we have as brokers to make sure that we're doing, people say all the time, well, which is the best program? Which is the worst program? The government won't even tell you that. What I like to think is that we try to find the best program for a particular individual based on their needs. I need this hospital, I need this doctor, I need this pharmacy. Those are the kind of things that we look at to make sure that they're getting what's best for them. One last thing with regard to that. With regards to medical, since you have that annual enrollment period, a decision that you make today doesn't have to be a decision for a lifetime, because remember, between October 15th and December 7th, you could make a change which would take effect the next year. The last thing we were talking about when I lost my train of thought for a second there was the special enrollment. Special enrollment is a thing that comes up during the year when a special circumstance exists. For instance, you move to Florida. Okay, and you've moved out of the area, so you may have to set up a program in Florida. Our more likely situation is where someone has worked longer than age 65, but now they're age 67. Well, everybody doesn't retire between October 15th and December 7th, so it creates a special enrollment where you can get on a program at that period of time.
Oh, that's good. And we're actually we're there now. We're at the end of our time. This has been really very educational. I hope that people have listened very closely to what you had to say. Actually, before we had our private conversation, I knew none of this, and I suspect most people who aren't in Medicare or approaching Medicare don't either. But thank you very much for being with us today.
Thanks for having me.
Appreciate it. And I've been speaking with Ken Schmidt. He is a specialist in Medicare services. This is going to be uploaded to YouTube, so if you want to see it again or point it out to friends, just go to YouTube, look up Conversation with Lee Presser, Ken Schmidt. Thanks. Bye.